Well, good morning. My name is Sue Morris. I'm a clinical nurse educator here at the New Brunswick Heart Center with Horizon Health. And the hospital and Zone 2 have started an initiative where we are placing AEDs in strategic areas of the hospital to enhance the time to first shock. And so I'm doing this video for nurse educators who teach BLS to show them the AED trainer. And so this is called the LifePak CR2, and it's really quite a lovely trainer. So it comes in a nice carrying case. I've taken it out, but to hold on to it, it has a lovely handle at the back. And I'm just going to take this off and I will show you that it takes 2 D batteries. And so as an educator, we always prepare our equipment beforehand. So just ensure that you have some spare batteries if you are going to use a CR2 trainer. That being said, our facilities have not purchased a large number of these, so I'm not going to be an advocate of purchasing a new AED trainer. When you are speaking to your staff, you can use the AED trainers that maybe your program has or that organizational learning has, and just remind your students that every AED has 4 universal functions. You turn it on, you attach. There is an analyze button on the majority. This new AED actually doesn't. It analyzes itself, or it will tell you, do not touch patient, analyzing rhythm. And then the 4th step is always, if a shock is indicated, most of the companies have chosen press flashing red button to deliver a shock as their universal language to encourage the person operating the AED. So I'm going to open my trainer, and the cover just flips up.
Adult mode. Remove all clothing from patient's chest.
So here is my patient.
Pull red handle to reveal pads.
And
look at pictures on pads.
And so the red handle.
Apply pads to bare skin, exactly as shown in the pictures.
As a trainer.
Press pads firmly.
As the trainer, do not discard this. This is reusable.
Apply pads to bare skin, exactly as shown in the pictures.
And so your
Press
student
pads firmly.
will peel back, apply the pad. So this is the one that goes
Apply
above
pads to bare skin,
the right nipple.
exactly as shown in the pictures.
And when I apply
Press
this,
pads firmly.
if I want to speak while the machine is speaking,
check pads for good.
I can push the power button, that is the center button here, and it will pause and I can do my discussion. So I'm applying my right-sided chest pad, and when I do, you'll see that it's going over an electrode. I have no option to remove this because it's my mannequin. However, you will instruct your students that anything that is here in the way, such as a medication patch, an ECG electrode, needs to be removed. And so, apply electrodes. Now I'm going to go back and let the machine speak. So I'm going to press the power button.
Good contact to bare skin.
And so I'm applying
Check
my left
electrode
side.
tray connection. Do not touch patient.
So hands up, do not
Analyzing
touch.
heart rhythm. Everyone clear. Do not touch patient. Delivering shock.
I'm clear,
Shock delivered.
you're clear, we're all
Provide
clear.
chest compressions to the beat.
So, in our AEDs that we have purchased, you will not have an automatic delivery of a shock, and I will set this machine up so that it instructs a student to press the flashing red button to deliver a shock. And there are two scenarios that you can use. And to use those scenarios, I'm just going to put my pads back on my plastic training tray. And so these are reusable. The pads are moderately expensive, so please take care when using them. And so I would like to change my scenario. There are two scenarios that you can use. The first scenario says to shock the patient when you initially find them. After 2 minutes of CPR, then you will stop, it will analyze, and it will give a second shock, 2 more minutes of compressions, and then your third rhythm check, there is no shock indicated, and so the student will get back on the chest. But if I wanted to go to scenario 2, which is a little bit quicker, the first time we apply the pads, it is a yes, so meaning a shock is indicated. We deliver 2 more minutes of CPR, and then the second round, the shock is no longer indicated. And I will show you how to change that. So you open your device, and down here in the corners are little tiny tabs. And I am going to push in on those tabs, and I can remove this whole plastic tray. And then you're going to see a screen. Main menu. If you want to enter the main menu, then you press the arrow pointing to my left. And then it comes up, scenario 1, and you can make changes. If this is your trainer that you are using for your program, you can make changes and you can change it for every student. So it's adaptable to how you are teaching. And so I move my arrow down to move up and down on the screen, and it comes down to shock advised. And so scenario 1 says yes, yes, no. What that means is the first 2 times you do a rhythm check, a shock is indicated. The third time, no shock indicated. But you can go in and change that using your back and forth arrows. You're not going to create havoc or create a problem. This is intended to be operator specific so that you can make it tailor the needs to each student. To put the pads back in, you'll notice that there are pins up here. And so we have to take a little bit of care when we are putting our pads back in. This is the same as if we were replacing pads in a real AED in the CR2 that we are going to use throughout Horizon. We have to put the top portion of this in first. And so slide it up like this and push it down. So it's very easy to get out. You push on these 2 tabs here, and that brings it out. And then to put it back in, slide it in and push down on the bottom. That's it. That's how you replace the pads, and that's how you access the scenarios. If you want to just leave the scenarios the way they are, then please feel free. You don't have to enter that area. The nice thing about this is I'm going to push and hold it for 10 seconds, and that's how I turn it off. But maybe I am caring for a pediatric population. And so these AEDs and its trainer can be used on pediatric populations. So I'm going to turn on my trainer.
Adult mode.
And it says adult
Remove
mode.
Child mode.
I'm going to
Remove
push.
all clothing.
So I want to speak to my students, so I've hit the center button. And so I show them there's a little icon here and the button to the right of the on button that is for pediatrics. And so the difference is not in the pads because we use the same pads. The difference is in the delivery of joules. So for an adult, we deliver 200 joules with the first shock, 300 joules with the second shock, and all shocks after that are at 360. But for a child, because they have smaller bodies and less resistance for the electricity to go through, our first shock is at 50 joules, second shock is 75, and all shocks after that are at 90. So this is really the AED trainer when you are all done. Please tuck these wires and be as organized as you can in underneath. Make it as neat as possible. And I'm going to push and hold and turn my off button so I'm not wasting my battery. There's also a battery indicator underneath the pad, so when we were at main menu, you could scroll down and you could see battery. It'll say high, medium, or low. And so 2D batteries. And this is really it for the trainer. It's very simplistic, very easy to use, just exactly like the actual AED itself, which looks like this. So nice carrying case. When I open it, this is how it looks. And so I've also done an instructional video on how to use this AED for staff. So if you are in a BLS course right now, your instructor will also show you how to use the CR2 Life Pack throughout all of Zone 2 facilities. So before we finish this in service, I want to remind you as instructors, this part that we peeled off, that the student would have peeled off to access the pads, is reusable. And so don't discard it. It will lay back on top of the pads and it will fit in to a groove all the way along so that when you go to access it for your next group of students, they will be able to pull the red handle and remove the packaging like they do in a real AED. So thank you for your attention. If you have any issues, please don't hesitate to contact me. My name is Susan Morris, and I can be found in the Horizon directory. Thanks, and have a great day.